Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Welcome to the Dr. R Show. On today's show, we're going to be speaking with Dr. Mitch Abrahams, a urologist, about the kidney stones, and kidney cancer. Dr. Abrahams, thank you for joining us on today's show.
Thank you for having me.
Could you tell us a little bit about your background? You're a urologist, and that's someone that does what?
Well, urologist is a doctor who specializes mostly in surgery and medical treatments for problems of the urinary tract and the genital tract. So we work on kidneys, we work on bladder problems, we work on genital problems, incontinence and cancer work for those organs that we cover.
And where did you go to medical school?
I went to medical school up north at Albany Medical College, 4 years of medical school, and then a 5-year residency at the same place after that. And then I did a year of fellowship training, University of California, San Francisco, where I learned how to do minimally invasive surgery, which is what I specialize in currently.
Why do we have kidneys? What do they do?
Well, the kidneys really do 3 important functions. The first thing is that they filter toxins. So as our body is making cells and getting rid of old cells, there's toxins that build up, and those have to be excreted, some by the liver, but a lot of them through the kidney. So excreting toxins is the number 1 function. Number 2 thing that the kidneys do is regulate how much water is in your body. So to make sure that you're not too low on water and dehydrated and not fluid overloaded, they regulate how much water is circulating around in the bloodstream and in the body tissues. And the third thing that the kidneys do is they make some hormones which help with some other remote factors in the physiology of the body.
And why do we have 2? They must be awfully important.
They are important. Obviously, you need kidneys to live, and if you don't have kidneys, then you need to have dialysis, which is a replacement for the functions of the kidneys. Why we have 2 is a very, very interesting question. There's not an exact theory, but most people say that symmetry is the reason why we have 2. For example, we have a left ear and a right ear, left arm and a right arm. So symmetry of animals and natural systems is very common, and that's one of the big reasons. The other thing is redundancy, so that you have more function, so that if each part of the kidney is not as efficient as we get older, we still have plenty extra to maintain us.
So the kidneys are filters. They filter the blood.
That's right.
And how much blood do they filter every day?
It's really amazing to think that it's thought that about 25% of your blood volume is in the kidneys at any 1 second. So that means 12.5% of your blood volume in each kidney at any point of time. And so when you do the calculation for the average sized human being, it's about 120 to 150 quarts of blood that are filtered throughout the entire day.
So 25% of your blood volume is in an organ that's the size of what? How big is your kidney?
Basically about the size of the palm of your fist.
That's pretty amazing.
Yeah, it is pretty remarkable. It's a very high flow system, obviously.
And how much urine do the kidneys produce a day?
Most people, of course, it depends on how much you drink. Most people produce about 1 quart to 2 quarts of urine for 24 hours. That's pretty average.
And how do the kidneys do their job? What anatomically special about them?
Well, it's very interesting. Obviously, the mechanism is very, very intricate. So basically, the blood comes into the artery of the kidney, and through different branches, the blood vessels become smaller and smaller and smaller until they get to basically about 1 blood cell wide little tubules that are called capillaries. Okay? Right next to those capillaries are little tubules that carry the beginnings of the urine. And those 2 tubules run side by side. So what happens first is that the part of the capillary where the blood comes in has little openings in them. And all of the chemicals that need to come out go through those little openings, and they go into the fluid tubule, which is right next door. And then as those 2 pathways follow each other through the different parts of the kidney, the things that we need to keep in the blood go back into the bloodstream. So they do that either through little holes that go the other way, for example, proteins and things like that. And sometimes there's actually little microscopic little chemical pumps that pump different chemicals back into the bloodstream and whatever's left over is in the urinary tract. So that's the part of the kidney where the urine is actually produced. The second part of the anatomy that's important is the urinary tract anatomy. So all of these millions and millions and millions of tubules that have the fluid in them come together in separate parts of the kidney called the calyces. And that's where all these tubules come together almost like a whole bunch of highways coming together. They all feed into a very central part of the kidney called the kidney pelvis. And from there, they connect to a tube that goes from the kidney all the way down to behind and into the bladder, and that's how the urine gets down to the bladder. And then, of course, we have the lower urinary tract to get rid of the urine.
Now, what portion of the kidney produces the hormones, and what hormones does the kidney produce?
So there are separate cells in the meat of the kidney that produce the hormones. There's two main hormones that the kidneys are responsible for. The first one is called renin, and that is very important for regulating blood pressure and how much fluid we have in our body. Without that chemical, you would not have enough fluid, and obviously if you have too much, you'll retain fluid, and that can be problematic for your heart and lungs and things like that. The other hormone is erythropoietin, and that regulates how many red blood cells you have circulating around. So the red blood cells are made in the bone marrow, and erythropoietin is the chemical that tells them how much to make so that we're delivering oxygen to all the important parts of your body.
Now, what about the adrenal glands? Are they considered part of the kidney? Are they in the kidney capsule, or are they outside of it?
That's very interesting. The adrenal gland is a separate organ that sits on top of the kidneys. They're inside some of the connective tissues, but they're not exactly connected to the kidney in terms of urine flow or anything like that. The adrenal glands are small glands that make other types of hormones. There are some blood vessel connections that go to the adrenal and come from the adrenal that go through the kidneys, but really they're really just sitting next door.
And how big are the adrenal glands? Are they very, very small where it's hard to see during surgery?
That's right. The adrenal glands are very, very, very small. They're usually just a few millimeters thick and maybe at most about an inch in width. And they're flat organs, very similar in color to the other surrounding tissues. So they can be challenging to identify in kidney surgery.
So now, before we get to kidney stones, we're going to need to take a quick commercial break, and we'll be right back.
Hey guys, I'm Megan and this is Christina, and this week on Inside Fitness, we're going to be talking about training the back. Now the back muscles are the latissimus dorsi and the trapezius, and they are responsible in moving your arms at the shoulder joint, and they actually work the opposite of the chest, so they're going to be used when you're doing pulling type movements like pull-ups.
So today we're going to focus on the lat pull down and the back extension. So Megan, if you could go ahead and hop on this machine, we're going to start with the back extension. So what you can do is you really want to make sure that pad is just going to be slightly lower than your pelvis. So she's kind of showing you where her pelvis is there. What I want you to do, Megan, now is just go ahead and cross your arms in front of your chest, and then go ahead and lean down. Perfect. And then you're going to exhale as you come back up, really squeezing those muscles together, kind of pushing those shoulder blades down your back. Go ahead and do it again. This is a really great way to work out those muscles in the back, as well as the hamstrings and even the glutes. If you need to add a little bit of variety, you can always do this holding dumbbells if you feel like you need to get a little bit more workout in. There is an actual yoga move that you can do that's going to be engaging the same muscles if you don't have one of the machines. So it's called the Superman. You just want to get right down here on your belly. And what you're wanting to do is you want to lift your legs off the ground, really engage those glutes, and also lift your arms off the ground. So you're really kind of engaging your entire back. You want to try and hold this here for about 30 seconds. You can do your arms to the side as well, or you can do it like this where you're flying. This is really good to squeeze your shoulder blades together and just kind of squeeze everything, and it's really working out that back. So the second exercise I want Megan to demonstrate for us today is the lat pull down. So she's going to sit here on the stability ball. Some lat pull downs in gyms will actually have a bench, but if you can use a stability ball, it's really going to force you to engage all of your muscles and make sure that you're balanced. So go ahead and grab the bar slightly wider than shoulder width. We're going to make sure that she has a nice weight on there as well to make it nice and challenging and really engage those muscles. So Megan, if you could just lean back slightly. We want a slight curvature in the back just to make sure you're nice and supported. And then go ahead and exhale as you pull that bar down, touch your chest, and inhale as you let it back up. Let's do that again. Perfect. Know that she's really kind of working her shoulder blades together, squeezing them down the side of her back. It's really going to work your lats and your traps, and you're getting a little bit of a bicep workout in as well. And this is another thing that you can really help engage that 3 set of 10 rule.
And now never forget to stretch when you're done with the workout. So we're going to do a little quick back stretch. So we're just going to interlace our fingers in front of us. We're going to push out away from us, rolling the back, and really feel that stretch. And hold for 15 to 30 seconds and repeat 2 to 3 sets.
So make sure to incorporate some new back workouts into your routine this week. We'll see you right back here same time on Inside Fitness.
Hey guys, I'm Megan and this is Christina, and I don't know about you, but when I consume too much red meat, I can have an upset stomach, which is why I've been considering a vegetarian diet. Now, whether you choose to adopt a more plant-based diet for ethical reasons, health reasons, or anything else, you need to plan ahead and be prepared. Now, if you're avoiding animal products like meat, fish, poultry, eggs, and dairy, you're going to have to get your essential nutrients elsewhere like grains, beans, fruits and vegetables, and some nuts and seeds.
So being a vegan or a vegetarian, one of the things that you might have the most trouble getting is protein. So a couple of things that you can do to supplement having meat would be to eat a lot of beans, several different types of nuts you could include in your diet, or nut-based milks like almond milk or cashew milk. Even soy milk really does include a lot of protein in it. One of the things that is a really excellent snack when you're wanting to get some protein are eating garbanzo beans like we had done in the other episode. Also hummus. So garbanzo beans, chickpeas, hummus, they're all in the same family, loaded with protein, excellent snack. The other thing that you want to make sure you're getting a lot of is the omega-3 fatty acids. With the absence of fish, it's a little bit more difficult to get those omega-3 fatty acids, but you can get them with, of course, fish oil supplements, vitamins that you can buy at any store, or you could use several different types of oil. Canola oil, soy oil, actually walnuts have a lot of omega-3 fatty acids in them as well, so that's a really good option. Additionally, you want to make sure that you're getting a lot of iron in your body. Now, iron is something that I always need because I'm slightly anemic, which means I just don't have enough of it. So when I don't have enough of it, I feel really tired, sort of lethargic. I just feel kind of lightheaded. So it's really important. And I like to eat meat. So it's not something that, you know, necessarily comes from eating meat. You can get it by using things like cast iron skillets, dark leafy vegetables like spinach. Anything in that really family is something that you can do to eat a lot of iron. And the final thing you need to make sure you're getting enough of is B12. Now, B12 is found in pretty much every animal product that you can get. So, I mean, you're talking eggs, you're talking cheese, milk, just basically the whole gamut. So you really want to consider taking a supplement. If you go to, you know, certain smoothie stores or health food stores, they even have it in a liquid form, where you just like squeeze that little thing and it puts you like the right amount right here, and then you just sip it down and then you're good to go. So hopefully this gives you some ideas on some ways that you can incorporate a more vegan and vegetarian lifestyle while still getting the nutrients that your body needs.
Welcome back to Dr. R. I'm here with Dr. Mitch Abrahams, and we're going to be talking about kidney stones. Dr. Abrahams, what are kidney stones?
Well, kidney stones are crystal structures that form in the urinary tract, part of the kidney. And as anybody who's tried the past one will tell you, probably one of the most painful medical conditions out there.
And how common are they?
Very, very common, unfortunately. It's estimated that somewhere between 10 and 15% of all Americans will at some time get a kidney stone. Very, very common problem.
Why do we get kidney stones? Why do they form?
Well, they form mostly because of salt that's in the urine that concentrates from not drinking enough fluids. So the most common cause of kidney stones is dehydration. And that's why people who live in warmer climates, such as here in Texas, get a lot more kidney stones than people who live up north. That they form based on 3 specific principles that are very well worked out. But it's interesting to note that the exact microscopic thing that starts the kidney stones is not known. So the first step is still unknown despite all the medical research. But we do understand the next 3 steps. Step number 2 is crystal formation. So what happens is the chemicals that are in the urine get concentrated enough that they come out of solution. Just like if you had sugar crystals in your iced tea and you don't stirred up. The crystals are just sitting there. So urinary tract crystals are a similar type of thing. Number two, you have to have clumping. So if you just have crystals and you just wash them through the urinary tract, nothing happens bad. But if they clump together, that's when you start having a 3D structure that can cause trouble. And the fourth step, the third thing that we understand well, would be adherence. So that clumped crystal structure has to stick to the kidney so that it can grow to a big enough structure that it's going to cause trouble. So again, we don't really understand the first step, but the next three steps are pretty well worked out.
And so what are the risk factors that predispose somebody to getting kidney stones?
Well, the big thing is risk factors for not getting and staying hydrated. So living in a very warm climate, doing a lot of physical activity, people who exercise, runners, things like that, people whose jobs require them to be outside in the hot sun, landscape workers, factory workers, people who are sweating a lot is a big risk factor. Also, drinking a lot of caffeine and alcohol, which are both diuretics, that's a risk factor. We see two age groups that form kidney stones. People who are chronic kidney stone formers often start in their teens and 20s, and then there's sort of a time where not a lot of people get kidney stones. And then as you start getting into your 50s and 60s, we see another peak of people who start making kidney stones.
Does diet impact kidney stones, things that you eat?
Extremely, extremely important. Diet is the biggest factor for kidney stones. So basically the biggest thing is what you drink and how much you drink. Okay, a lot of us like soda, coffee, tea, and things like that, and all of those things are going to predispose you to stones. Now, the thing that will offset your risk for stones would be fluids, mostly things without caffeine, and specifically citric acid. So things like lemonade and things like that are good. Dietary factors are very, very important. Salt is a big factor, and we'll talk about maybe the details of that in a sec. But basically, eating a lot of salt, which a lot of us do, is a risk factor for kidney stones. Protein intake is a big factor for people making kidney stones. It turns out that a lot of times, for decades, people were told that calcium is a big problem. Since the stones are made out of calcium, the assumption was that if you eat too much calcium, you're going to make kidney stones, therefore avoiding calcium would be good. It turns out that was 180 degrees wrong. It turns out that if you avoid calcium, people actually make more calcium-type stones. So bottom line is, intake of calcium is not the cause of most people's kidney stones.
And what are the different types of stones? How many are there?
There's lots of different types of stones, probably 20 or 30 in total. But the far majority of people have calcium-based stones, most commonly calcium oxalate. Oxalate is a chemical in foods that we eat. It's in foods that people consider pretty healthy. Spinach, black pepper, it's in bran flakes, things like that. It's also in some things not so healthy, chocolate, peanuts, things like that. So oxalate is also made by the liver. That's the most common type of kidney stone. Number two is calcium phosphate, or a combination of calcium oxalate and calcium phosphate. It's very, very common. And phosphate stones are thought to form with high protein intake. Urinary tract infections can cause those. Then we also see uric acid stones. Uric acid stones sort of number 3 in incidence. And those are caused by protein crystals that build up, mostly for people who have gout, which is a problem with uric acid metabolism, and people who have very acidic urine will make uric acid stones. And then there's infection-based stones. That would be the next most common. So if you get a kidney infection, that can change the urine pH and form kidney stones. And then there's a lot of more rare types of kidney stones. There's inherited forms of kidney stones. There's medications that can turn into kidney stones. Those are much more uncommon.
And what are the signs and symptoms of a kidney stone?
Well, the most common presentation for a kidney stone is what we call kidney colic. Okay, colic is a very, very severe pain episode. Pain usually starts in the flank, which is sort of this area near the ribs, can come around to the lower belly area, can even go into the genital area, and it's extreme pain in a lot of circumstances. Go into the emergency room, night or day kind of situation. There's a lot of times nausea and vomiting with that. Sometimes a fever. If there's an infection, or even if there isn't, you can have a fever. And blood in the urine would be the other common thing that people might see.
And how do you diagnose a stone? What's the best test?
Well, usually when somebody comes into the emergency room with a presumed stone, we'll check a urine test, and in the urine test we can look for blood. We can actually see the little microscopic crystals, which will hint to us that there's a stone there. And most commonly, we're going to do some x-ray test. The most common x-ray test now is CT scan or CAT scan. That's a three-dimensional imaging test of the entire belly cavity that'll show us kidney stones, kidney blockages. It shows us how big they are, where they are, how many there are, shows if both kidneys are affected, and so it's a very, very good imaging test.
And how do you treat kidney stones? What are the treatment options?
Well, a lot of kidney stones that are small will pass on their own. So sometimes what people just need is some help with medications, pain medicine, nausea medicine. Now we actually give medicine to help people improve their chances of passing stones. That's become common over the last 10 years or so. So we'll give a class of medicine called alpha blockers, Flomax, Uroxetrol, Rapaflo, one of those medicines, and that's shown to increase the chance of passing small ureter stones. If the stones are too big to pass, there's only one real type of stone that's actually dissolvable inside the body. That's uric acid stones. And so if somebody comes in and we diagnose uric acid stones, we'll give them medicine to dissolve that, assuming that they're not in a lot of pain and don't need surgery for that. If they have the most common type of stones, calcium stones, then we're usually going to have to do surgical therapy if they're too big to pass. Three main options. The most common is what we call shock wave lithotripsy. Developed in the mid to late 80s, non-invasive therapy whereby a machine is brought behind the kidney and delivers very precise, very focused, large, high-energy sound waves. And the sound waves bounce off the stone, break them up, and then the patient passes the crystals. For stones that's not going to work for, we use what's called laser lithotripsy. So in the mid to late 90s, there was an invention called holmium laser that came out. And in order to get the laser to the stone, with the patient asleep, we put a fiber optic telescope up the urinary tract. We find the kidney stone, and we have a little tiny laser fiber, not much bigger in diameter than a human hair. We put the laser right to the stone, and that will break up any type of stone, no matter how hard it is. And then we retrieve the fragments after that. And for stones that are much too big to do that, we do surgery called percutaneous surgery, where we actually make a very small opening right into the kidney to be able to remove larger stones. And much more rare than that, we'll do robotic or laparoscopic surgery to remove large stones.
Well, that wraps up today's episode. Tune in next week for another exciting edition of Dr. R.